Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Aaron Hartman with us. Dr. Hartman is a triple board certified physician, clinical researcher, and founder of Richmond Integrative and Functional Medicine. His medical career took a radical turn when conventional medicine failed his adopted daughter, Anna, who was born with cerebral palsy. Determined to find answers beyond pharmaceuticals and surgery, he dove into functional medicine and watched his daughter make what specialists said was impossible progress. That experience reshaped his entire view of healthcare. Today, Dr. Hartman helps patients across the country reclaim their health when traditional medicine says there's nothing more that we can do. His new book, UnCurable, From Hopeless Diagnosis to Defying All Odds, shares his personal and professional transformation and reveals what modern medicine often overlooks about the body's ability to heal. Welcome, Dr. Hartman. Thanks so much for joining us.
Oh, it's great to be here. I'm excited to share my story, my book, and all things medical.
Yeah, absolutely. That sounds like such an amazing story and also journey for you. So, first of all, tell us a little bit about where you like, you know how in the movies they always have the normal life and then there's the exciting the inciting incident and things begin to shift
Yeah.
and there's a new world. Okay, tell us your original world, where what was life like for you before and then your inciting incident sounds like it was your daughter. Set us up.
Yes. Well, in normal life, I was in the military at that point in time. I was a captain and a medical doctor in the Air Force in Florida at the MacDill Air Force Base, and just got married. Been married for 2 years, for 2 or 3 years roughly, and
Mhm.
just do my thing, living life, getting deployed when I get deployed and learning things. And my
Yeah.
wife, who's a pediatric occupational therapist, her specialty was kids with special needs.
Mhm.
She you know, would always come home and tell me about patients. And she had this really crazy caseload of kids with really complicated genetic issues, things I'd heard about in medical school, but knew I'd never seen in real life. So it's kind
Okay.
of interesting. One day
Mhm.
she comes home and she's like, "Hey, there's a little girl. Her foster home is closing down. Would you be willing to take her in?" And
Mhm.
so, me being me,
Yeah.
my first question was, it's really funny how you grow and how you change. But at that point in time, my first question to her, well, sure, we can do that, but can we give her back? And my
Yeah, right.
wife, yeah, I know it's kind of funny how what life does. But
Uh-huh.
so we brought her into our home, and my wife intuitively knew that I would eventually fall in love with Anna,
Yeah.
and that's what happened.
Yeah.
And so, just being very duty driven, values driven. I'm like doing the best I can for Anna. And there's two major inflection points. The first inflection point was her GI doctor. And one of the things with kids with cerebral palsy, which is something kids are born with at birth, there's usually some kind of birth trauma injury. And for Anna, it was crystal meth exposure. It was a stroke before she was born.
Mhm.
Lots of things. And so she failure to thrive. And so what that is just you're not growing. You're too small. And
Yeah.
so her GI doctor was like, "Hey, let's put a feeding tube in. Let's cut a hole in her stomach, put a
Mhm.
plastic tube in, and then get some weight on her." And we knew that was wrong for
Yeah.
many reasons because it affected future speech, future development. It's amazing how much chewing and swallowing is involved with just learning how to talk,
How
and
old
then
was
learning
she at
how.
this point, by the way?
She was probably about 14 months.
Okay. Okay.
Yeah. And then obviously walking, you gotta like crawl first, and you can't crawl
Right.
with the plastic tube hanging out your belly. It's kind of hard.
Yeah.
Yeah. And so we opted out, said no, we're not gonna do that. Well, the system didn't really appreciate that. We actually got reported to Child Protective Services
Oh no.
for neglect. Technically it was medical neglect, child neglect, medical neglect, because we wanted to feed our daughter real food and not do a surgical procedure. And so that was one inflection point where I kind of realized the system doesn't like it when you say no. Now,
Yeah.
I was a doctor, I am a doctor, captain in the Air Force. My wife was in the system, occupational therapist. So we were able to navigate it, which most families actually can't.
Sure. Yeah.
Most families don't have the ability to do. It's just complicated. But the major inflection point, which when everything changed, was 6 months later
Yeah.
when my wife found a growth chart for kids with cerebral palsy, and Anna was right in the middle.
Uh-huh.
She was 50th percentile, which means she didn't need the procedure.
Oh wow.
Yeah, so the specialist didn't know. Now, my
Oh.
wife and I debate. She thinks the specialist was new and just was trying to make money. She's malevolent. I give them the benefit of the doubt. But either way, like it was all of a sudden, like for me, it's like I have to be the specialist for my daughter. I have to figure it out. If they
Right.
don't know, then who does? And that's when like that weight, the
Yeah.
burden, so to speak, of her care became mine. And I
Right.
started researching, get up early in the morning, and that's what has absolutely changed my entire practice of medicine.
Yeah. Wow. Okay. So, and then as you were researching this, how did your paradigm change? Walk us through that process too. So you recognize that the system isn't going to do it for you and you have to take it on yourself. But I'm assuming philosophically, this is a major shift. How did that occur?
Everything's in hindsight, right?
Sure,
Things
yeah.
just happen,
Yeah.
yes, there was this philosophical shift, but that was more like, looking back and going, wow,
Yeah.
I've just
Okay.
changed absolutely everything. For
Yeah.
me, it was more like it was desperation.
Yeah. Yeah.
It was, we don't have options. I have to figure it out. This is my burden to bear.
Yeah.
And I started studying whatever came across. So one of the early things was autism. That
Hmm.
was one of the first things I knew that was a neurological, neurodevelopmental thing with kids.
Hmm.
So start realizing about environmental toxins, chemicals, nutrition, gene expression, all these things play into that.
Yep.
That led me off the track. I found this guy, Kirk Wooler, who's a
Hmm.
pediatrician who specialized with autism, and down this pathway of metabolic illness, how gut health, how
Hmm.
metabolism affects it. Found Amy Yasko, who's a PhD who had a child with autism, and she specialized in gene testing to
Hmm.
see what genetic predispositions for vitamin deficiencies kids could have and you could treat. And so every time I'd get off the track on one thing, I'd find something else. And you do that year after year after year. All of a sudden,
Put it
your
together.
your
Yeah.
brain starts changing.
Sure.
Then I came across the ABIHM, which is a national organization for holistic medicine,
Mhm.
and they had a conference in Tampa, Florida, actually, which I flew back to Florida because that's where I was stationed. And my mind was blown. I'm a pretty smart guy,
Mhm.
had learned a lot. There's not at that point in time, there wasn't a lot I hadn't heard about because I'd read all my textbooks and stuff.
Right.
I'm
Yeah.
literally in a conference where I have no idea what these people are talking about.
Oh, wow.
And it was kind of like, it's almost like you look behind the curtain, like
Yeah.
don't look behind the curtain, right? And
Sure.
ignore
Yeah.
the man behind the curtain, right?
Right.
And I saw it, and it's like you have this. People talk about this aha moment in functional integrative medicine where it's a point of no return,
Yeah. Yeah.
where you all of a sudden you see this thing. If you're an ethical person who's values oriented, values driven, like it
Yeah.
changes everything. Either
Yes.
you have to like, if you really want to help people, either you change your course,
Right.
or you have to like say, look, I'm not going to do this,
Yeah.
and you go a different, and you actually, it's almost like you go off away from the truth, and you go to a different way, kind of sort of, which might be a
Sure.
little extreme way to say it, but
Yeah.
I was all in. I had no choice. I mean, this was desperation. And so I went down that pathway, which led to other pathways and other pathways. And
Yeah.
in my paradigm, the way I looked at medicine, the way I looked at the world
Yeah.
changed
Right.
completely.
Yeah. Yeah. So, and I don't know if you could encapsulate for us, it's possibly a tall order to say this, but if you could put in a bite size what that aha moment was, what was the realization that, can you say what the shift was?
Shift is that the system didn't have all the answers, and they didn't like it when you would look for them elsewhere.
Got it. Okay. Gotcha.
And
So, yeah, go ahead.
and it's just one of those things. Some people aren't willing to go down that pathway because it means going upstream.
Right, right. So, and then as you're going down this road, I don't know if you would agree that the system traditionally, the traditional medical system is generally set up to try to treat symptoms, whereas the functional medicine, naturopathic world is more about looking at root cause and trying to fix that. Would you agree with that statement? Yes. Okay. So, and what you'd started to discover, I assume, was that the body is capable of healing itself based on your book, right?
Yeah.
Okay. So what did that mean for Anna? What was your process like for her? What did you implement and where did you start seeing improvements and shifts?
Because of my belief system, a statement I say is you were made for health.
Hmm.
Your body was made to self-heal and self-repair. If you can just find what's blocking your body's natural process of healing, give it
Exactly.
what's lacking, it'll do what it was made to do.
Right.
Like, and just because of my faith and my belief system, it kind of makes sense. And so all of a sudden, it's like super scientific, super smart, brilliant people using your books and textbooks to say this very super basic, intuitive thing, like you were made for health, basically. And
Right.
so that just kind of informed. I mean, it's like, okay, she can heal. Now
Right.
she can get better. Now, her being normal is not going to be your or mine, Lauren. It's not going to be our normal. But
Yeah.
what's her normal? What's her optimal? And how
Right.
do I get there?
Yeah.
And so all of a sudden now it's like, okay, I've got this belief. She was not made for this. She was made for this. She has a built. She was made to heal. How do I get her body to do this thing after crystal meth, after birth trauma,
Yeah.
after abandonment in the hospital, after her corpus? She had a genesis of the corpus callosum,
Mm.
which is like the part that connects the left and the right brain. Like
Mhm.
they'll do corpus callosotomies to treat seizure disorders, right? So literally that part when she was born wasn't developed. And so how can I get her brain to heal itself,
Yeah.
basically?
Sure. Yeah.
And that was my challenge.
All right. And so what big picture, take us 30,000 feet. What was it that you implemented for beginning to shift this for her? Was there a process? Can you look back and say these were the steps?
Yeah.
Yeah.
It was everything.
Yeah.
Um, it was everything, of course, right?
Sure. Yeah,
The, the
obviously.
the foundations, one of the things I've learned, and this is like a 15, like looking back 15 years, right? I
Mhm.
was going down these weird things, stem cells, peptides, HBOT, that all the stuff you can think of we've
Fancy
done,
stuff.
neuromuscular stimulation,
Yeah.
yeah. But the foundation for all of that is super basic. It's
Oh,
real
yeah.
food,
Hmm.
using food like a drug. I would literally make brain mayo. I make mayonnaise
Uh-huh.
out of balanced omega-3, omega-6
Yeah.
fatty acids based on fancy tests I did at Hopkins to
Hmm.
literally replace bad fats in our brain. We would make granola,
Yeah.
but it was not regular granola. It was made out of almonds, um, almonds, walnuts, flax, chia, and we basically make it, which have lots of trace minerals.
Hmm.
They have the natural balance of omega-3s and omega-6s, and the
Hmm.
kids would eat this granola. We'd,
Hmm.
we'd actually take raw milk and make kefir. We all of a sudden started using food as if it was a drug
Hmm.
to actually help her brain heal. And so that was the foundation: real food, a clean environment, learned how important, avoiding mold, not drinking a neurotoxin called fluoride or chlorine, like in your water, like avoiding chemicals and toxins in your
Yeah,
environment.
seriously.
Yeah, yeah. And the stimulation, like
Yeah.
physical activity,
Yeah.
having stimulated movement. And
Uh-huh.
so it was super basic stuff, but
Right.
done in a fashion that activates the body's natural healing capabilities.
Right. So you're simultaneously identifying, if necessary, or just assuming they're there, the obstacles to cure, getting rid of them, giving building blocks for her to heal. And hopefully she wasn't a super picky eater as a toddler. Was she willing to do all of this?
Well, initially when we started, it was like I'd spend an hour trying to
Uh-huh.
get her to eat, which
Uh,
is, again,
yeah.
most families would have said, put the tube in, it makes it easier, we're kind of done. And so you'd spend a
Yeah.
lot of time.
Right.
But it's funny because the whole process of giving her real food,
Right.
using healthy fats, using organ meat,
Hmm.
using extra virgin olive oil, using all these things to help her heal, she is a foodie now.
Mm,
And
that's
she became a
great.
foodie. Yeah. And so she loves real food.
Yeah.
She's like, she'll eat anything.
Mhm.
Um, my son Khalil, when we got him, he had really bad asthma and eczema, and all he ate were donut holes for the first 6 months of his life. So
Yeah.
when we first got him, which was years later, he
Yeah.
was super picky. And
Uh-huh.
so there were days he got breakfast for lunch, he got breakfast for lunch for dinner. A couple
Mm,
of days he got breakfast for breakfast the next day, right?
right. Yeah.
Because it's amazing what hunger will do for a kid.
Sure.
And eventually he started eating as well. So, and I know
Right.
there's nuances to picky eaters and
Sure.
textures and all that kind of stuff, but
Yeah.
it's hard to get a kid to eat real food sometimes, and you got to be willing to do the hard work.
Hmm. Yeah, absolutely. And so now, how old is she? 15?
Oh,
Yeah.
she's 19.
She's 19. Okay. So
Yeah.
what does life look like for her now in terms of what, like, contrast where she is to what would be expected for a CP patient at that age in general, who was at her
Okay.
level of disability at the
Yeah.
beginning?
I love numbers. The typical
Yeah.
kid her age would have already
Yeah.
had 13 surgical procedures. She's had none.
Wow.
In her entire life, she's
Yeah.
had, so I'm sorry, since we've had her when she was 12 months, she's had antibiotics once. So compare
Wow.
that to a typical kid, how many antibiotics have they had in their life?
Right.
The answer is typically dozens. She's
Yeah.
had no cavities.
That's amazing. Yeah.
Okay, if you know anything about meth mouth or crystal meth, like
Mhm.
it destroys your teeth, drugs destroy your teeth. I mean, that's all she was exposed to for the first
Right.
nine
Yeah.
months of her life in the womb, right?
Right. Yeah.
No dental issues.
That's
Does she
a,
have problems? Sure, yeah, other stuff,
yeah.
but it's like these marks that the average person has issues with, she has no issues with.
Right. That's fantastic. So,
Yeah.
and emotional regulation, I assume that also was improved comparatively
Yeah, I
too.
mean, she's
Sure.
got some brain issues. She's
Right.
19. She's probably
Mhm.
more like a 12-year-old, a 14-year-old, like emotionally.
Right.
She does
Mhm.
have some emotional liability. But
Uh-huh.
one of the things with kids with CPs, they're usually on seizure medications,
Yeah.
usually on ADHD medications, sometimes neuropsych drugs that
Yeah.
have horrible metabolic issues,
Mhm.
sometimes birth control pills and hormones to control horrible
Mhm.
periods
Yeah.
because they'll have a lot of issues with that. She's
Mhm.
on no medications.
Yeah, that is amazing. Very cool. So, and kind of back to the contrast between your worldview now and where the worldview kind of started. Um, I kind of feel like a lot of the double-blind placebo-controlled studies are almost they're almost all of them are targeted at symptoms. Like if you have this condition, let's give you this drug or even this supplement and see whether or not there's a clinically significant improvement. And it's not taking the step back and looking at the bigger picture of what are the obstacles to cure for this person? What are the potential building blocks that are missing for this person? And how might the perspective shift? Like there's a place for those studies, absolutely. But I feel like the emphasis almost creates that paradigm of this is all we can do. I don't know if you'd agree with that statement or not.
Well, I mean, I agree with it, but the way evidence-based medicine is supposed to be,
Right.
as the JAM article, I think it was either 89 or 91 that came out about this new thing called evidence-based medicine.
Right.
It's
Uh-huh.
supposed to be clinician experience. So
Right.
I've seen 100,000 patients in
Yeah.
7 countries and 4 continents. So they're
Yeah.
supposed to take that into account.
Right.
Patient preference,
Yeah.
like
Uh-huh.
what would you actually want for me to do for you, Lauren, right?
Sure.
And
Yeah.
then up to date data.
Yeah.
What's happened in the last 45 years, we've ignored patient preference
Mhm.
because what you want doesn't matter. We ignore clinician experience because it's not scientific. And we're looking only at data. And the problem with that is that 50% of all, and this is according to Dr. Ioannis, who is one of the publishers for TLOS, which is the largest online medical journal in the world, 50% of all um, published research studies, the findings are later found to be false. So when
Heard
you
that
see a
too.
published, yeah, when you see a study published, there's
Yeah.
a 50% chance in general that the findings are not correct. And so all of a sudden, if that is your only North Star, it's
Right.
wrong half the time. You know, in
Sure.
baseball, batting a 500 is awesome.
Yeah.
Flying planes is horrible, right? And so,
It's, yep.
right. And so it's one of those things that once you realize that, yeah, yes, published data is ridiculously important. It gives you a data point.
Yes. Right.
But for personalized medicine, you got to take all these thousands of data points and then fill the gaps in to actually make the collage to figure out
Right.
what do I need to do.
Right. Yeah. And reason your way through the physiology of what's happening with this person. And let's put all of these pieces together, not just say, the algorithm says do this.
But you
So,
said this something interesting, reason your way through the physiology.
right.
And so my first year in medical school did biochemistry,
Mhm.
right? Did genetics,
Yeah.
and then was told we never, after we finished our boards part one
Huh.
and got tested on, we never need to know about it again. Forget about it. So that's what I did. I learned it. Fast forward to my functional medicine
Oh,
training, my metabolic medicine training, and all of a sudden it's like we're going back to citric acid cycle. We're going back to
yeah.
metabolic issues. We're actually doing, and to your point, it's literally looking at doing a test on someone's metabolism, seeing
Right.
your malic acids off, so your citric acid's low, and
Mhm.
then basically what nutrients get you there: B12, folic, vitamin
Yep.
C, trace minerals, and plugging
Right.
those holes in,
Right.
retesting, and look, the metabolism's better.
Right.
Like literally, this is like the purest form of medicine because it's
Yes.
taking that basic stuff and then
Yeah.
individualizing absolutely everything for the
Yeah.
person in front of you.
Yeah. We're going back to first principles, like actually figure out what is happening for this individual and deal with that. So what is your book, The UnCurable From Hopeless Diagnosis to Defying All Odds? What is it that you hope your readers will take away from that?
Big point is if this little girl, if Anna can do it, you can do it too.
Yeah.
If this little girl exposed to crystal meth,
Yeah.
stroke before she was born, that part of the brain that connects not forming, functionally
Mhm.
blind at birth, if
Right.
she can beat every single solitary odd,
Hmm.
every odd, everything, no one ever expected her to be where she's at now,
Right.
then you can do it too. So
Mhm.
I think the message of it is just
Yeah.
that you
Right.
can do it too. You
Right.
just need a guide, you need a path to go on, and you need to basically do it.
Right. Yeah. And I love the fact that you're starting with hope because if you don't believe something's possible, you won't try. So you have to have that as the beginning place. If you think that there's no possibility, you're not even going to dig. You're not going to expect that there's anything that you could do differently.
Let's, I think, going back to worldview, what is your worldview?
Right.
And, I just don't believe that being sick and ill is the way things are supposed to be. I feel like the world is supposed to be better. And
Hmm.
because of that, we're not there. Like, so what do? We don't give up, but we
Hmm.
have hope. And so
Hmm.
we work harder, we
Yep.
strive harder
Yep.
to get to that better place. And so, and for me and my daughter, that's what that resulted in my medical studies. But you're 100% right. If you don't have hope, then you're not going to do things that you wouldn't do otherwise.
Right.
And to get these kind of outcomes, you have to be willing to do things that no one else is willing to do.
Hmm. Yep, for sure. So what have I not asked you that you want to make sure you leave with our audience?
Well, actually, I think the biggest thing is you've asked me lots of things. I think it's to summaries like your basics, diet, exercise, sleep, stress reduction are super important.
Yep.
Um, environment is super important, but also having a team around you. Something we
Mm,
didn't talk about, maybe that's it, is having those people around you that can support you because it's hard to do this on your own when you're sick.
for
So you
sure.
need,
Yeah.
family, friends, experts, physiatrists, naturopath, acupuncturist, all these things around you. A good old-fashioned medical doctor, someone that can help guide you. You
Yep.
need your own team. You need
Mhm.
to be the CEO, the boss of your own team. And so
Yep.
you need your own, I call it in my book, I think I've referred to it, your own circle of the ring, your own
Mhm.
fellowship of the ring,
Yeah, I
where,
love it.
yeah. And um, Frodo didn't get there by himself. He had a bunch of people around him, and you need that team around you to get you to the end. But in the end, it's you're the person who's carrying the ring of power.
Right. Yeah. I love right back to the hero's journey. That's great.
Yeah.
So, where can people go to learn more about you and maybe pick up a copy of your book?
To learn more about me personally, you can go to www.aaronhartmanmd.com. And from there, that takes you to like my podcast, takes you to my practice, a
Mhm.
YouTube channel, all that kind of jazz. And the book itself is uncurablebook.com. And
Mhm.
that'll take you to the book. And then you can just click on it, and it'll take you to Amazon probably, and you can buy it.
Fantastic. So, I will link to that in the show notes. What's the name of your podcast, by the way?
Made for Health.
Need for Health. Perfect. Sounds great. Well, thank you so much, Dr. Hartman. This has been really inspiring.
Oh, great. Thanks a lot.